Education, Training and ICT is on a 3-day fact-finding mission to tertiary institutions. The team's first visit was at the Gambia College campus in Bekama. Modu Bajan reports.
Beginning at the Gambia College, the Chairman National Assembly Select Committee on Education, Training and Information Communication Technology, Yaya Gassama, detailed that the visit seeks to collaborate with public tertiary institutes for the development of the country.
We hope that at the end of the session, we would have identified most of the challenges. I would urge all of you, or all of us, to be open and frank in the ensuing discussions, because that would help. There is nothing to fear. We are only working with you to try to improve the education delivery in the country.
The principal, Gambia College, Abubakar Jalo, bemoaned the fact that staff of the college are lowly paid.
Our workload and our conditions of service do not commensurate, but that mainly is as a result of the way Gambia College has been financed. We are found in every school in this country. The college was virtually neglected throughout the period that we had no figurehead to rule the college.
Aside from the general state of staff welfare and issues relating to the college curriculum and learning materials by members including Sekuba Jajo of Busumbala, nominated parliamentarian Ndai Yasin Seka raised concerns about student performance.
There is very low staff motivation in the Gambia College. Talk about the salaries, the promotion. We know that you have so many students outside that you have to go and observe. If principal talks about his office without the mobility, what about a utility vehicle for the college?
How do you enroll your students? If you look at the performance of the students, sometimes it's very, very poor. If we are not doing anything, I think then it should be a point to be noted, and then see how best we will do so as to enable our students to really perform properly.
The member for Wuli West, Siria Jata, recalled negligence of a policy document which would have made Gambia College a degree-producing institution way back in 1986.
If you look at the 10-year education policy which ended in 1986, you would see that it was provided that degree courses would be taking place in the college within that period. And by 1986, they would be doing a master's course in the college. But because we don't do things right in this country, we are always running into problems. This college should have been the starting point of the University of the Gambia.
Gambia College Vice Principal and Head School of Education, Madam Aisetundao, spoke of the institution's readiness to improve quality.
Instead of having PTC, we'll have a diploma in education. For HTC, we'll have an advanced diploma in education, secondary. Now we're going to run, courses just like the university, so that to transfer of credits to the university, it will be very easy, because I think that is one of the challenges we have been having. Our students will graduate from the Gambia College after having done 3 years in each of these programs. A student can even do 6 years work. After doing PTC, you do HTC, but then when you go to the university, you do 4 years again, like somebody who is just finishing grade 12.
The committee will hold a similar engagement with the academic staff alongside students of the 4 various schools of one of the country's most important tertiary institutions. Modu Bajan reporting for GRTS News.
Meanwhile, the Ministry of Basic and Secondary Education, in collaboration with the National Assembly member for Banjul North, are in the process of setting up a vocational center at the abandoned buildings of Old Crab Island School in Banjul. Samuel Ba reports.
The official unveiling of the Task Force Committee for the proposed Banjul North Vocational Education Training Center was highly lauded as a means of further empowering young people to acquire livelihood skills and technical education. The idea was conceived by the new National Assembly member for Banjul North, and the venue for the project is the abandoned buildings of the Old Crab Island School.
It was during the election campaign when I passed through this place. I saw the facility, and then I thought that something needs to be done. So I made this pledge to myself and to those that were with me that this is going to be a priority project if I am given the mandate by the electorate of Banjul North.
Crab Island is one of the oldest colonial city schools built in 1958 to provide technical education. The site has not been used for the past 5 years, and the school had to merge with Gaba Jahumpa Upper Basic School.
I wanted to serve as a TVET center, that is a technical and vocational education and training center that is going to cater for young people of various categories, school dropouts, unemployed young people, unskilled young people, these potential migrants, and also returning migrants who are here. And if you go to street corners in Banjul, see many of them, they are doing nothing, basically, you're literally wasting their lives, wasting the time away.
The proposal for the Banjul North Center, according to experts, is in line with ECOWAS AU strategies on technical and vocational education and training.
Gambia is part of the revitalization process on the revitalization of the ECOWAS region. We have recently completed the ECOWAS strategic TVET program. That was in September last year. We have developed the strategy for all the ECOWAS member countries.
Basic and secondary education officials applauded and readily gave their support to the initiative of Honorable Usman Silla.
The ministry wants to pursue a two-pronged approach with regards to the former Crab Island, where you would be having a technical high school catering for students with the requisite academic entry requirements, existing alongside a technical and vocational education and training center for the unemployed, unskilled, potential and returning migrants, as well as school dropouts and vulnerable groups.
The official inauguration of the Task Force Committee for the Banjul North Vocational Education Training Center is expected to impact positively in the lives of young people through skills acquisition. Samuel Bach, GRTS.
14th June is World Blood Donor Day. The day is set aside to raise awareness of the need to donate blood to save lives. The theme for this year's celebration is what you can do, give blood, give now, give often. The Minister of Health and Social Welfare delivered a statement to mark the day.
Fellow Gambians, today June 14 is annually recognized and celebrated worldwide as World Blood Donor Day. The event serves to raise awareness of the need for safe blood and blood products, and the objective of the annual commemoration is to celebrate and thank those who give the gift of life, that is the blood donors. It therefore gives me a great pleasure to give a statement in recognition of this important day. Fellow Gambians, you will agree with me that blood transfusion is a key component of the health system, and patients' timely access to safe blood and blood products at all times is a key indicator of the success of every health sector. Blood, unlike other medication, is the only treatment resources that cannot be purchased anywhere. Hence, it can only come from humans to treat patients. Therefore, this year's World Blood Donor Day campaign underlines the role every single person can play in helping others in emergency situations by giving the valuable gift of blood. It also focuses on the fact that it is important to give blood regularly so that the blood stock is sufficient and continuously available for emergency intervention. It is on this background that the World Health Organization gave the theme for this year's celebration as Give Blood, Give Now, and Give Often. Thus, the theme is chosen to help us reflect and think about emergencies where blood is needed. What can we do to ensure blood is always available when needed, particularly in emergencies?
That was Safilo Sise, Minister of Health and Social Welfare, delivering a statement marking World Blood Donor Day. The Medical Research Council, Banjul Office, has recognized the efforts of its researchers and scientists in malaria, child nutrition, and other health challenges. Fatu Janembai reports.
The Medical Research Council pays glowing tribute to 6 of its scientists. Dr. Abdullahi Ahmad and Samantha McCain were 2 of them. The The scientists were recognized by the unit for their research work on disease control and elimination theme, nutrition and vaccines and immunity theme.
The festival is organized with the aim of informing our stakeholders and the general public on the rationale behind our activities and also on our achievements.
MRC plays a very considerable importance to training and career development and has continued to support the development of activities of this department in order to create opportunities to build competence, skills, knowledge, but most importantly, research and leadership.
Research has been an important component of development, and for MRC, recognizing its scientists for the great research work is one of the best things they could do, said Professor Umberto.
Our unit has been able to monitor mortality trends thanks to our demographic surveillance systems. We have a demographic surveillance system in Farafani covering about 50,000 people, a demographic surveillance system in Upper River Region, South Bank, covering under 80,000 people, and then one in West Kiang covering 18,000 people. So thanks to this collection of data that has gone on for the last 20, 30 years, we were able to provide the Gambian government data that monitor progress of mortality, and so we are able to know that childhood mortality, the Millennium Development Goal 4, had been achieved.
But how important is the research information gathered by the scientists for the general well-being of the citizenry?
What we are hoping to do is use these technologies, the functional near-infrared spectroscopy and the EEG, to determine why the brains of the infants in the West Kiang region are not developing properly, in the hope that in the future we can use that data to design interventions and optimize their brain development and give them the best chance in life, really.
Through research, MRC the Gambia said it has successfully contributed to the reduction of NDG4, which is aimed at reducing child mortality in the country, a development that only emphasized the importance of this ceremony.
Mosquito is the cause of so many deaths in humans, such that it is number one among all these animals that are listed. So it is a very dangerous small animal, I'll say, because of this number of deaths it's caused. About 720,000 deaths are being caused by mosquito. Not necessarily by malaria also, but by other diseases like yellow fever, Zika virus, which are all transmitted by mosquito.
The Wednesday event also coincided with the 70th anniversary of the Medical Research Council. Reporting for GRTS News, I am Fatijan Mbai.
The United Democratic Party, UDP, on Wednesday donated 16 wheelchairs to Edward Francis Small Teaching Hospital. Aissatou Jatta witnessed the presentation at the hospital grounds in Banjul.
These wheelchairs presented to Edward Francis Small Teaching Hospital will go a long way towards helping both the hospital workers and patients for a quick service delivery.
We are happy that you are here today, joining us in our efforts to provide quality health care services to the people of this country. We are equally delighted because your coming here sends the right signals.
The Chief Medical Director described the gesture as timely.
The hospital is in the need of a lot of items. We need a lot of support. But I don't know how you happen to know that we need wheelchairs, but we highly need them. Because we've been getting a whole lot of requests for wheelchairs at our emergency rooms, at the wards, at the theaters, and virtually everywhere in this hospital. And as we keep on saying, this hospital belongs to the entire nation.
Juan Khalili Diouf, a supporter of the United Democratic Party and a businessman at the Albert Market, is the man behind the initiative.
On behalf of the United Democratic Party, we are here today gathered to present some wheelchair to the Edward Francis Small Hospital. Though it's very small, but I'm sure it will go a long way to the victims who will be in need of them.
The public relations officer of the hospital said the proper upkeep of the wheelchairs for their sustainability is not only a concern but a priority for the hospital management.
We want to tell you the importance of this generation. We all know diabetes is in the increase, and it resulted to people having amputation. So most of our patients in the surgical wards now are amputated and they need wheelchair. So the need cannot be overemphasized. But I'm appealing to other organizations to please be helping Edward Francis Small Teaching Hospital.
The presentation is a major boost for the hospital as the major referral center aims to improve services. Reporting for GRTS News, I am Aissatou Diatta. We will be